Hi guys, welcome back to my YouTube channel Basic Knowledge. Chronic bronchitis. Chronic bronchitis is diagnosed on clinical ground. It is defined by presence of persistent productive cough for at least 3 consecutive months in at least 2 consecutive years. It is common among cigarette smokers and urban dwellers in smoke-ridden cities. Some studies indicate 20 to 25% of men in 40 to 65-year-old age group having the disease. In early stages of the disease, the cough raises mucus sputum, but airflow is not obstructed. Some patients with the chronic bronchitis have even of the hyperresponsive airway with the intermittent bronchospasm and wheezing. The asthmatic bronchitis, while other bronchitic patients, especially heavy smoker, develop chronic outflow obstruction, usually with associated emphysema. Risk factor: smoking plus air pollutant. Distinctive feature of chronic bronchitis is a hypersecretion of mucus beginning in the large airways, although the most important cause is cigarette smoking. Other air pollutants such as sulfur dioxide and nitrogen dioxide may contribute. These environmental irritants include hypertrophy of mucus gland in trachea and bronchi, as well as an increase in mucus secreting globulate cell in epithelial surfaces of the smaller bronchi and bronchiole. These irritants also cause inflammation marked by infiltration of macrophages, neutrophil, and lymphocytes. In contrast with asthma, eosinophils are seen in chronic bronchitis, whereas defining mucus hypersecretion is primarily a reflection of involvement of large bronchi. Airflow obstruction in chronic bronchitis result from small or airway disease induced by mucus plugging of bronchial lumen, inflammation and bronchial wall fibrosis, and a coexistent emphysema. In general, while the small airway disease chronic bronchiolitis is an important component of early mild airflow obstruction, chronic bronchitis with a significant airflow obstruction almost always is complicated by emphysema. It is postulated that many of the effect of environmental irritant on respiratory epithelium are medium by local release of cytokines such as interleukin 13 from T cells and innate lymphoid cell, the transcription of the mucin gene in bronchial epithelial, and production of neutrophil estate are increased as consequences of exposure to tobacco smoke. Microbial infection often is present but has a secondary role, chiefly by the maintaining inflammation and exacerbating symptoms. The lymphocyte and macrophages and sometimes also admixed neutrophil are frequently seen in bronchial mucosa. Chronic bronchiolitis is small airway disease characterized by globulate cell metaplasia. Mucus plugging, inflammation, and fibrosis also is seen. In severe cases, there may be a complete obliteration of lumen as consequences of fibrosis. Bronchiolitis obliterans. It is submucal fibrosis that lead to luminal narrowing and airway obstruction. Emphysematous changes often coexist related to all that we discussed here. If you want to ask anything, then you can ask it to me in the comment section. And if you are new to my YouTube channel Basic Knowledge, must subscribe my YouTube channel.